That's a good question.
Awesome.
Yeah, Stephanie, audio check. Am I okay?
Yeah, you're good, Joe. August, you might want to shift so the window isn't behind you.
Okay.
Oh. Yeah, I got the sun in my face. My phone doesn't work so well in the house, so I got to kind of do this. It sucks so bad for that West politics, or Wisconsin I'm sorry, interview. I had to reschedule it. You know, at first August, I thought when I saw your signs, I thought that was Tyler August. I was like, wait, that can't be right. There's a Tyler August Biden yard. Like, what happened? But
yeah, I just thought August went better with assembly than Schutz.
Yeah.
kind of a mouthful, so.
I guess so, man. Oh, man. Is that a piano? That's a nice piano there, Joe.
Thank you.
I didn't know that you.
Too bad I don't play.
Huh?
I said, too bad I don't play.
Oh. Yeah, it's like me with crock pots, man. I don't really cook so good. They're just in the house. They're just sitting there. Or like a waffle iron. That's too much for me. I can't. It's too organized of a cooking activity. There's got a bunch of waffle irons and stuff sitting there.
Good.
Air fryer gets some use though. How you doing, Speaker Voss?
Hello, how are you, Will?
Good, good. Just got done slaying the doors for the day, and had to.
Beautiful day to be outside.
It was. It really was. It was a little bit cooler yesterday when I was out, but we had the walking app up today, and I noticed that there's a lot of doors that aren't on there anymore. I think they loaded in just kind of folks that are hard R's in there, but we're still kind of going, just door to door. We're just making sure that we check off the houses that are in the walking app as we go along. Everybody gets a sign.
They actually take off the people who've already voted. That could be what it is too.
Yeah, that too. Yeah, there's only been a handful of folks, maybe not quite a handful, maybe one or two, literally out of a few neighborhoods I've not really said, yeah, I've already done my absentee vote there.
I actually get quite a few that have told me they've already voted.
Oh wow. Yeah, I met. And I had mentioned that in the conference call the other day. I met this one woman on the south side of Racine. I guess she had got one of the mailers that went out. She goes, "Oh, I just saw you. It's nice to put your name to a face." And oh yeah, but she said, "Yeah, I haven't cast my absentee ballot yet, but I'm glad you stopped by." And and I can tell you that knocking some doors, there's still plenty that are in folks' mailboxes. So I think maybe some folks are just getting into that. Yeah.
So looks like we're just waiting for one more technical thing and we should be getting started pretty soon.
Okie doke.
But it's awesome. I mean,
Oh, Stephanie, you're muted.
Yeah, I think she just got muted.
All right, I got unmuted.
Yeah, you kind of went.
And we'll
kung
get into
fu.
the ground rules soon, but there is an actual mute function, which is very exciting. So I
You're
expect
saying
there'll be so
that in
much
a
more.
debate?
Yes, exactly. So if people go way over on the time, we'll be able to do that. Isn't that exciting of a Zoom function that they don't have during televised debates?
Yeah,
They might.
Stephanie,
They
if I
might,
go
yes, the
over,
next debate, right?
Stephanie, if I go over, please feel free.
yeah.
Well, we'll get into the ground rules soon, but I have these excellent. Oh, I just realized I did not write these backwards. So,
Oh, no, they're still fine.
yeah,
they're
that
fine.
says 10. That says time backwards. And that says mute. So sorry about that. I should have written backwards.
No, it works for us.
Yeah,
Yeah, that's I really like the fact you've got that 10 seconds so we can wrap it up. Great,
Mhm.
appreciate it.
Yeah.
yeah. I can be a chatty Cathy. I'm an old car salesman, so please, you'll have to stop it.
So yeah, we'll give you the 10 seconds and, a little leeway on the warning, but
Yeah.
the whole idea is, I think you guys got the list of questions, right?
Yep.
So we want to try to get through as many as possible, and we're going to do 1 minute for each candidate. And then from there, we're expecting to have some audience questions and, some more general.
Got you.
So it will be a little bit different. I mean, this is my first time moderating a Zoom legislative session or a Zoom forum. So that's kind of exciting, but a little different, of course.
Yeah.
I just saw a little sign, Stephanie, we're live. Is that true?
Yeah, I just saw
Um,
that too.
Should be, yep.
Oh, cool.
And I know we're sharing it on the Facebook pages as well, and it's recorded so people will be able to watch it after the fact. And we
Cool,
do
baby.
at the Journal Times have a reporter watching, so it's all on the record.
Okay, cool beans.
Mhm. Mhm.
Yeah, bro.
Well, good evening. This is the
Good evening.
technologically challenged president of MIAW Racine County, but I want to welcome you all to our virtual forum this evening. I'm Pat Bohan, president of MIAW Racine County. We are extremely pleased and gratified that we have 6 candidates for state assembly districts covering the bulk of Racine County participating in this forum this evening. From the 66th Assembly District, the incumbent Greta Neubauer and the challenger Will Luberson. Welcome. From the 63rd Assembly District, the incumbent Robin Voss and the challenger Joel Jacobson. Welcome. And from the 62nd Assembly District, the incumbent Robert Whitkey and the challenger August Schutt. Is that the correct pronunciation of your name, sir?
It's Schutz.
Schutt, I apologize. August Schutt. Welcome. We are also extremely pleased to have as our moderator this evening the managing editor of the Racine Journal-Times, Stephanie Jones. We're actually both at the MIAW Racine County offices, but in separate rooms, and we're trying to kind of coordinate this and remain appropriately socially distanced and handle all the different technical challenges. So it'll be a learning experience for all of us. This virtual forum will be available both via Zoom webinar as well as the MIAW Racine County Facebook Live page, and it's also connected to the Racine Journal-Times Facebook Live page. And as Stephanie said, there'll also be a reporter covering this event. We have a substantial number of people in the audience as well. This will be divided into 2 sections. The first section, we have prepared questions that have been submitted to the candidates in advance. And Stephanie will go through the ground rules in terms of the amount of time available to each candidate, which will be equal to answer the questions. And then we will also ask our audience members if they have questions pertaining to mental health issues in our community to submit them either via the chat function on Zoom or the Q&A function or via Facebook Live. Nicole Smart, our program director, and I will be monitoring those sites. Then we'll consolidate the questions, get them to Stephanie, who will then pose them to the candidates. So again, thank you all for your willingness to participate this evening. We greatly appreciate you making your valuable time available to address these important issues. And in terms of the audience questions, the one request that I have, NAMI of Racine County is a nonpartisan organization. So please pose questions related to mental health in a respectful manner. That will be a requirement for this forum. So that all being said, it's now my pleasure to turn it over to our very capable moderator, Stephanie Jones. Thank you.
All right, I kind of explained what the ground rules were, which is essentially we'll do a minute for each person to answer the questions. And I already showed them, I have some cards that I'll raise up to kind of give them a 10-second warning and then, you know, say stop, even though they're written backwards in the camera. And then we have some background IT support, which if somebody goes like 10 seconds over the time limit, we would start to mute just to proceed to the next person. Although we expect this forum to be much more civilized than other recent debates. So with that, what I wanted to do is I'm gonna switch up on who gets to answer the question first. And we wanted to start with just 1-minute intros for people to kind of, you know, introduce yourself and whatever else you want to say within the minute. So I'm kind of going based on around the clock, what I see here on Zoom. So Will, I will start with you for your first minute.
All righty, thank you, Stephanie. Hello, ladies and gentlemen, friends, family, and neighbors. I'm Will Laverson, campaigning and asking for your confidence to represent our city in the 66th Assembly District seat. A bit about me, I'm a father, a former business owner, and a veteran. And primarily the businesses that I help out are small businesses and nonprofits. I spent some time down in St. Petersburg, Florida, and I worked for an organization called Bowley Centers, where a great majority of what you'll hear of my mental health, mental wellness, and mental health treatment background really stems from. It was a VA-funded recovery facility for folks that were in some either substance abuse or homeless situations. And I was a safety officer there, which means that I did some intake, some contact note entry, and also I passed meds, psychoactive meds there. But thank you for this opportunity. I look forward to answering your questions.
Greta, if you'd like to go next.
Sure. Thanks so much, Stephanie, and thanks to NAMI for hosting this forum. We are so lucky to have NAMI in this community. They've been an incredible partner in the work that I've done over the last 2.5 years, and hope to continue working with NAMI and so many of you if I am reelected. So I've been in office for about 2.5 years now, representing Racine, the 66th Assembly District. Big priorities for me have been really listening to members of our community and building collaborative, community-driven policy, taking that to Madison and really fighting for the district up in Madison, and working with progressives around the state to build public support for the policies that we know need to happen there in the Capitol, many of which we will talk about tonight, many of which are related to mental health. Other things that I've really worked on, particular issues, include fighting for strong public schools, investments in quality, affordable healthcare, good jobs, reducing racial inequities, and addressing climate change. But we'll talk about all those things another time. For now, really glad to be here.
Robin, if you could go next.
Sure. Thank you, Stephanie, and hello to everybody who's watching us at home. Thank you very much for joining us, and especially thanks for listening to what we're going to talk about tonight, which are the important issues facing the voters when they go to the polls between now and November 3rd. I was elected to the Assembly in 2004 after spending some time on the county board. I'm married to my wife, Michelle, and we own several small businesses in Racine County with about 75 employees. In addition to that, I am super proud of the fact that one of the things that I have worked on is issues that are related to mental health. The very first speakers task force that I put together right after I became speaker was the first speakers task force on mental health reform. A Republican and a Democrat working together with over a dozen bills that became law signed by Governor Scott Walker. Since then, we've been focusing on all kinds of bipartisan ideas that really bring us together, things that we know we can actually get done. That's why 90% of the bills that we adopted over the course of the past session, really over the course of the past 6 years, have been adopted with votes from both political parties. But there are issues we are going to hear about tonight, which draw a contrast between us, and I look forward to discussing those and the ones that bring us together. So thanks for being here.
Thank you. And Joel, if you want to go next.
Thank you, Stephanie. I appreciate that. And to all those in the 63rd and all over Racine County, hello to everybody watching. I know there's a lot of people out there, and thanks for your attention to a very important subject. I've lived in Burlington 26 years. I've been married to my wife, Jerry, for 39 years, going on 40. We've raised 2 wonderful children. But what I want to emphasize is that we have all known people who've been affected by mental health. We've known suicide in the family, other people. I mean, everybody gets affected by this. And so it's great that we can have this forum, that we can talk about a very challenging time. Not only is it challenging all the time, but now that we're in COVID, it's even more so. So greatly appreciate the time to be here and looking forward to the discussion.
Bob, if you could introduce yourself.
Good evening, everyone. My name is Bob Whitkey. I represent the 62nd Assembly District. I was elected in 2018, so I'm finishing my first term. Married. I've got 4 children between the ages of 18 and 35. My background is in finance and accounting, and I participate on several committees in the Assembly this year. The Ways and Means, I was vice chair, and also participated. The 2 other major ones I had were the Education Committee and colleges and universities. Mental health is one of the high priority issues that I know I have tried to advocate for and address. And I have welcomed getting a better understanding of the resources we have in the county through the NAMI organization. And I look forward to the conversation tonight.
Thank you. And August, if you want to introduce yourself.
Thank you, Stephanie, for moderating tonight. My name is August Schutz. I am a candidate for Wisconsin State Assembly District 62. I've lived in the town of Raymond my entire life, a proud Racine County resident. I graduated from Union Grove High School in 2016, and I just finished up my college degree at the University of Minnesota this last spring. I'm bringing a fresh perspective to the district. I don't have the experience like some of the candidates on here tonight. I don't have that experience, but I'm bringing a fresh perspective. Like many here, I have friends. I have dealt with challenges when it comes to mental health, and it is near and dear to me. And I think that we need to do more as a state to address those issues. And so I look forward to representing those this January.
All right, thank you. So you guys did get some of the questions, and what I want to start out with doing, I think for the first question, I'll start by doing 2 minutes, because just to start out, people might want to describe a little bit more and get into a little more detail, and then we can talk about, for each question as it goes on, just keeping track of time. So just getting started, and for this one, I'll start with Greta. The global pandemic affects everyone, but especially those living with mental illness who are experiencing increased isolation, anxiety, and depression. What specific measures will you support in the upcoming legislative session to address the mental health consequences of COVID-19 in Wisconsin and in Racine County?
Thank you for the question, Stephanie. So, of course, it has been a really hard time for everyone, but most especially for those living with mental illness. I have spoken with countless people who are very worried about a family member or a friend and really are not sure where to turn to for support. So while mental health did have a spotlight earlier in the pandemic with programs like Resilient Wisconsin, more resources and direct services are necessary to help our community get through this crisis. We need to create and widely publicize resources, somewhere that people can go to get help right away. I know NAMI has talked about creating a phone line, right, that is always available, that is there if people need short-term counseling or long-term referrals. I'm absolutely in favor of that proposal. I also think we need to be providing additional funding for mental health support for young people. Before the pandemic in Racine, we had nurses running around to multiple schools in a day. We know we don't have adequate counselors and technology to provide mental health services at home. And this is critical for students' well-being and, of course, their ability to perform in school. So the legislature did begin some good work this year with the Suicide Prevention Task Force, but pilot programs, which we'll talk more about, are not enough. We need to be investing now to make sure that every kid everywhere in the state has the resources that they need. We need to make sure every kid has access to the internet and the technology they need for these services. And finally, I'll just mention telehealth. We have made some progress over the last few years in providing telehealth services, but we really need to make sure that every plan, including Medicaid, covers telehealth, covers mental health care, and we need to make sure that that technology and providers are available to every person around the state.
Thank you. And Robin, if you want to go next.
I always forget to unmute. Thanks for the question. It really has been, Greta's right, it really has been a challenging time, as we have heard, not just from constituents, but family and friends, and how they have been able to deal with the pandemic. Of course, I was on a phone call the other day with some hospital executives. We were talking about the fact that I think just about every person in Wisconsin is getting more and more irritable as we all figure ways to deal with the long-term impact of having less socialization, less ability to connect with our family and friends, and less ability to really lead a somewhat normal life. It's challenging. But you're right, people who have mental health illness issues are even more at risk, which is why in the last budget, I'm proud of the things that we already have done that are law today because of the efforts of many of us who voted for the budget. That actually increased funding for hospitals, increased funding for dementia specialists, increased funding for schools that they could put into healthcare. One of the things that really disappointed me was I authored a proposal in the previous budget which actually would have funded a matching program for every single high school student to have access to technology, along with giving school districts hotspots so that more people would have a chance to do telehealth and the internet, especially among young people. Governor Evers vetoed that entire program and just dumped it into the general fund. So unfortunately, many schools, instead of directing the resources toward accessing the internet where kids could have access to those specialists, especially now, it's just in the general fund and not being utilized for that purpose. So when I think about the things that the Suicide Prevention Task Force focused on, peer-to-peer was really important, and that's one of the things we wanted for kids. If you remember, we put the numbers on the back of every student ID so that they would be able to have a number that they could call around the clock to be able to get access, especially if they're having mental health issues. So I think there's a lot of things that we've done, but I certainly am open to working on some of the bills that didn't quite make it all the way through from our Speaker's Task Force on Suicide Prevention, and of course, increasing some of the funding in ways where we know it can be targeted and we know it can be effective, as opposed to just kind of writing a blank check without any ability to know whether or not the programs are actually getting the best bang for the buck.
Thank you. Joel, if you could go next.
Sure, absolutely. Thanks for the question, Stephanie. In reviewing what is on the NAMI website, I think the two things that the organization for the warm line, as opposed to a crisis line, but a warm line for those situations that aren't immediately dire, but they could be an orientation on a state network basis to help people either relatively short term or much longer term, and I think that's a fantastic idea. And the other one was on the telehealth, and I think that is also a very good idea from NAMI, and expanding that to with also the private commercial policies that would match that, as well as on the Medicare, Medicaid, that we can have a fully comprehensive program for that. A little more expansion on this. I think we'll discuss this throughout, and that is funding. And I know that there was a discussion of Mr. Evers. Well, I think we'll continue to discuss relative to how our funding works in the state, and I seek to, when I get in the assembly, to be able to help improve on that.
Thank you. And Bob, if you want to share your thoughts.
Certainly, but it seems like most of them have been covered. So as the speaker said, I voted for the budget that did increase funding for mental health programs that are delivered to our school. One of the things that hasn't been talked about are some of the other supplemental things that have to be considered during this. So for example, our budget also included a significant investment in bringing broadband into rural areas which have trouble getting access to different programs and so on. One of the things that I've made a priority with is to get to know, listen to the people as the organization, NAMI resources and so on, go with them to different functions they have and understand the day-to-day types of things they deal with, and how in our role as a legislator that we can help them through a number of different things. I also draw back on the experience I had in our school district, being board president for 2 years. One of the things that that you have to always remember is that no matter what school you go to, what group of children you are talking with, that they all have different needs. And so we can't just look at one professional to help. We need to look at counselors, social workers, psychiatrists, and a mix to make sure that we're extending services on. And we can't forget our law enforcement, first responders, and other people that are under extreme stress right now as well. Have to look to make sure that we pick up programs and have resources for them to access. Thank you.
And August, if you want to share your thoughts.
So the first thing when it comes to COVID, I think that we need to look at is we need to have a state legislature that's actually working for us. Currently, our state legislature hasn't passed a bill since April, and I think that's a huge failure on the people of Wisconsin during times like this. We've seen the physical impact on people, we've seen the economic impact on our state, and now we're going to be seeing the impact that mental health has taken, or COVID has taken on mental health. And so I think that one, we need a state legislature that's going to meet. Two, I think that we need to look at telehealth. We need to look at insurance policies, whether it's Medicaid, whether it's private insurance plans. And we need to make sure that they cover telehealth visits for people that can't leave the house. It would be a huge help to those people that are vulnerable. And then three, we need to have, looking at our schools, we have so many children, Racine Unified is all virtual. They don't have the access to go to a school counselor. They don't have that access right now. And so we need to make sure that they have someone checking in on them, whether it be them or the parent. And so I think that we need to make sure that our schools are also helping our children by providing mental health checkups to those students as well.
Thank you. And Will, if you could close it out on that question.
Absolutely. What I can share is that COVID did not cause new mental health diagnoses, nor did it cause any new sort of shortfalls. We already were not great at servicing so many people. When it comes down to mental wellness, there's a couple different ways to deconstruct that large monster. Number one, supportive services. What I can tell you from working in mental wellness is that there's a lot of folks who go from program to program to program, but those programs don't necessarily link up. For example, I worked in a transitional housing facility, which did provide some framework of treatment, but the vets got treatment actually elsewhere for supportive groups. And so just having a strong infrastructure moving forward would take care of a lot of the shortfalls that we had prior to COVID. COVID did not create, it compounded issues that were already there. For example, if you were someone that was receiving mental wellness services, when COVID came, your services kind of throttled back a little bit until maybe your organization or what have you that provides treatment brought up telehealth services for you. And so there's really no way to hit it all with one set of legislation. It has to be a consensus of different efforts into the larger whole of mental wellness. And also when it comes down to some of the factors that were in place before COVID, you have a lot of homes that were in a situation where their mental wellness wasn't already there, where if they were depressed or if they had some other mental health diagnoses, we already didn't do the best job by them. And so what we have to do is make sure that that we form a consensus. What you'll hear me talk about is a state mental health charter, which is a 72 county commitment from the various legislators and folks there. But we have to make sure that we do the best by people moving forward by implementing some of those measures.
Thank you. No, I mean, I appreciated all of your answers on that. Obviously, this is, I mean, it's the biggest thing going on right now. It might be, the biggest thing in the decade, the century. I mean, every single one of us is affected by this. I mean, obviously in different ways. So I appreciate all of your responses, and I know NAMI appreciates the well thought out responses on this issue. So I wanted to give that question to give kind of a general overview and kind of go into a few other things. If it's okay, I'll probably do 1 minute for some of the upcoming questions. Is that okay? So most people living with mental illness have experienced the negative effects of stigma. I mean, so that might affect them not getting treatment or being afraid to tell people. What's the role of the state legislature in eliminating that stigma surrounding mental illness? And for this one, I wanted to start with Robin.
It's interesting that you bring that up, Stephanie, because when we did our speakers task force on mental health, it was chaired by an emergency room physician, Dr. Eric Severson from Western Wisconsin, and a nurse who was a fantastic member of the legislature, Sandy Pash. And one of the things that she brought up in the very first meeting was the whole thing that stigma is the biggest problem that we deal with as we try to make sure people get the treatment that they deserve dealing with mental health issues. I think probably everybody here and probably everybody at home understands that there are people in their family who have mental health issues, and sometimes it's easier to look away. They might do something that doesn't make you proud, but it doesn't matter because it's a disease no different than if somebody has a leg that was cut off or they have cancer. It's all the same. So I think the first thing is every one of us recognizing that mental health and issues regarding mental health are no different than any other kind of health condition. It's important for us to say that, to be sympathetic to people who have those issues, and to make sure that we talk about it. So I guess that's the most important thing that we can do, because you can't necessarily legislate people's emotions, which is what stigma is based on.
Thank you. And Joel, if you could go next. Joel, I think you've muted yourself. If you want to unmute yourself.
I'm sorry about that.
There you go. I won't use that as your time. We'll start now.
Easers and technology, you know how it works. Any case, I want to say I appreciated Speaker Voss's answer on that, because it really is empathy and learning for so many people, and understanding that it's can affect anybody, first of all, and it is no different than a physical affliction. And we've all known people, and they can be on top of the world, and all of a sudden they go into a dark depression, for example. And so we're learning, I think, as a society to really speak of it in much less stigma terms. And so anything we can do as far as communication, and I do agree, you can't legislate emotion, but we can certainly help in this type of communication and communication at the legislative level.
All right, thank you. And Bob, if you could go next.
Thank you, Stephanie. I think the real role is to be available to local resource, to interact with them, to understand what they deal with, and to ask them, how do they need our help? Is it something they think we can fund? That's a role we take. Is it something from a policy perspective that we need to consider? Or do they need us available for events and so on? I know when I was in the school district, we used to visit school by school to give the visibility to young children and so on, that they could talk to us, interact with us. And so I think it's being available locally. I was also proud of this term where we actually passed legislation to rid our statutes of just old language and replace it with mental illness. And so, like I said, I think it's just to be available and to react to what they want us to do.
Thank you. And August, if you could follow up.
Yes, so agreeing with Speaker Voss, I don't think that any legislation can help with stigma. I think that we need to make sure that our state legislature is able to advocate for it, able to make it prominent, make the awareness available to everyone. I think that it's definitely a generational difference, a generational gap between we're dealing with stigma. I think people closer to mine and Greta's age are a lot more common to seek the help that they need when they need help, rather than older generations. They're less likely. And so I think that we need to provide the awareness as the state legislature and provide people with the resources that they need. And so I think that, yeah, that's how we got to get rid of stigma, is through resources and awareness.
Thank you. And William, if you could go next.
Yes, absolutely, August. That was kind of what I had alluded to here before. I can tell you that so a man think he does. And so what it is changing a culture. That's why we mentioned having a 72 county mental health charter for our state, to kind of get lawmakers and other folks, policymakers, in the mindset that this is something that we absolutely have to strive for, and that we have to make the best policy for. A lot of what you'll hear me talk about, especially with the caveat to safety, is that a lot of folks that are in things like the criminal justice system, for example, a lot of those folks are people that have not been serviced in mental wellness. And so we have folks that are now in a population of people that are already underserviced coming back to society, on top of having these issues that were never addressed. And so what we have to make sure that we do moving forward is that, as far as legislation goes, we can culture that through sponsoring things like a 72 county mental wellness charter, by putting healthy expectations on different nonprofits and other organizations that do the work, that will get state grants and things, to make sure that their mission lines up with the monies that they're getting and with the population that they're serving. As a veteran, I can tell you that there are many organizations that service us, but there are not many organizations that service people outside of that. So that's what we have to change.
Thank you. And Greta, if you could go next.
Yes, thanks, Stephanie. So we really need to be taking a proactive approach, not just to passing policy, but also to really meeting with and being present with community members. This is why I co-hosted a community conversation with NAMI this year before the pandemic, to hear from all of you, and many of you listening, I know, about the issues that are impacting you and your family, and to really think creatively about ways that we can address this issue going forward. We know many of the solutions to mental health issues, but we also need to continue to listen and to work collaboratively to come up with new policy. I also think it's really important for us to share our platform with other advocates in our community, and just really want to give a shout out to some of those folks here in Racine. We have particularly a lot of young people who have really creatively built and used their platforms to tell their own stories and advocate for others, like Alex Hart-Apendo, who is a leader on this issue while still being in middle school. I've been really moved to see so many young people who have decided to say no to the stigma and speak out and really improve our community through doing so.
Thank you. I mean, I appreciate, again, all of your answers on that. And I mean, the great thing about this is that it is, I mean, essentially a bipartisan type of issue that, I mean, having all 6 of you here together, I mean, it's great to just be able to hear those voices on both sides of the aisle supporting these initiatives. So I wanted to build off of it was brought up, I think, at one point during this. So the issue of incarceration. Unnecessary and inappropriate incarceration of people living with mental illness is a widespread issue. What is your view on the role of the state legislature in reducing unnecessary incarceration of people living with mental illness? Do you support continued expansion of the treatment alternatives and diversion program to divert low-risk offenders away from jail and into treatment? I guess I'll probably do a 1.5 minutes on this one. Do you guys think that's okay?
Yes. And Stephanie, that was actually me that had that caveat with safety in law enforcement.
So,
I'm sorry.
Yeah, and I think for this one, we will start with Joel. I'm trying to keep my rotation. So Joel, if you don't mind going first.
Dude, there we go. You can hear me? All right. Thanks, Stephanie. Regretfully, Wisconsin's level of incarceration rate is 28th in the world. So we got a lot of work to do. And in reviewing what NAMI said on the moving to the 138% on the federal poverty level, on the funding, I think that's certainly an appropriate move. And then also to on the retirees on the workforce. So excuse me, lost my note there. Yeah, so people are mentally ill aren't criminals. And so we need to improve where we're at for that aspect of where we're at currently with our policies. And there's a lot of things we can do. I know that Evan Goyke has put out some very great offerings on programs where we can improve our incarceration rate. We can also move to help our inmates so they can have access to better medicine, free phone calls, that type of thing. So we have a lot of work to do relative to moving people who need psychiatric help out of our prison system.
Thank you. And Bob, if you could go next.
Thank you, Stephanie. So our last budget, we did increase funding again for the TAD diversion program. I do support programs that are alternatives where they apply and they can help. I spent some time in Veterans Court with Judge Flancher. I was very impressed with the program that helps some of our veterans with these issues come out of not being incarcerated, but come back into society and restore their life. I think that if there are programs out there that would help us get those that are in prison with mental illness the help that they need, I think that I support those programs as well. And the budget process is normally where we start with that and move forward.
Thank you. August, if you want to go next.
Yeah, so one, being mentally ill should not be a crime. I think when you see someone that is having mental issues or having a mental breakdown in public, the only resource that we have is to call 911. That's the only resource that we have. And then when law enforcement does show up, it can escalate the situation. And so one, I think we need to provide our law enforcement with better resources, better training, to get them the help that they need in those situations. And so, but currently, when those people that do have the mental illness are in these situations and then go to prison, we just turn a blind eye on them, and we kind of just push it under the rug, the problem. And we need to actually provide inmates with the mental health that they need, resources that they need, be able to give them quality access to phone calls, public or health in our prisons as well. And so I think we gotta look at the whole situation when it comes to incarceration. And I do support TAD. I don't think that we should have these people that desperately need help and to put them in the situation with other individuals that aren't in the same situation as them. And so I do support TAD.
All right, thank you. I appreciate your answer. William, if you want to go next.
Yes, absolutely. What I'll tell you is that that caveat that we put folks there in jail. Part of that is how they even get there, that initial response. And so what you'll hear me talk about is celebrating and emulating success. One of the things that I've advocated for is the implementation of augments to our law enforcement professionals, or critical intervention officers, who would respond to calls specifically for non-arresting sort of matters. For example, the call that goes out to our first responders now is that grandpa is having a bad mental wellness day. We have regular law enforcement officers who respond. And just as many of the panelists have already pointed out, sometimes those interactions don't end as favorably as we would like them. And knowing that and moving forward, we should absolutely seek to implement that TED. And as a matter of fact, I had a thought of implementing something called a Treatment Reinvestment Initiative, or Wisconsin TRIACT, where we would provide funding specifically for these issues. Being a former resident of Florida has something called a Baker Act, where if you call and say that I have a Baker Act individual in my home, the responders already know that that is a mental wellness call, and they send these specially trained, in their case, critical intervention officers. They don't show up in a regular squad car. They show up in a clearly labeled intervention officer, and they de-escalate the situation and take that person to a place of treatment. We don't have anything like that here in our state, and we need to have it now, and then before.
Thank you. And Greta?
Thank you. So this is a really critical issue that I've been working on with community members and organizations in Racine for the last 2.5 years. Our incarceration rates, especially for people of color and those with mental illness, are unacceptable. And instead of pathologizing mental illness, we really need to be creating a state that's supportive of people who need help. So I'll share a few of the things that I proposed in the last session. One was that I co-authored a bill to provide more resources for crisis intervention training for police officers. Many officers at RPD are already receiving this training, but everyone should get it statewide, and Republicans refused to give that bill a hearing. Through my work on the City of Racine Police Reform Task Force, City of Racine Police Reform Task Force, I also proposed a crisis intervention response team that would be prepared and trained to specifically work with those who are experiencing a mental health crisis. Worked on that recommendation with task force members and spoke with Racine Police Department leadership about that. And those recommendations are currently being compiled and passed on to the mayor's office and city council. So I'm very proud of that work. I've also actively supported other criminal justice reforms, including TAD. I also attended the Veterans Treatment Court graduation last year and was really struck by the low rate of recidivism for those participating in the program. You know, we know how to keep people out of prison who should not be there, but we just have not made the necessary investments to support those programs. I will certainly continue to advocate for them and hope that we can take them up next session.
Thank you. And then it works out, we have Robin right after you.
So the last budget, as Bob said, actually increased funding by, I think, one of the largest amounts in state history for increased funding for the TAD program. I think it was over a 10% increase because we do agree that everything we can do to try to ensure people who only deserve to go to prison go there is something that not only is empathetic and sympathetic, but it's also smart. That's why one thing Joel said I do definitely agree with is that just because you have a mental illness doesn't mean you're a criminal. Unfortunately, people who commit crimes oftentimes have mental illness. So we have to also give justice to the victims, but also make sure that people hopefully don't recidivate by getting them into programs like TAD, making sure that we have the resources for that. I certainly agree with that. I love Will's idea. I hadn't heard about that before, to actually see if there's the ability. Somebody just said, what is the TAD program? TAD is treatment alternatives, basically, where instead of having somebody go traditionally into prison, you would have somebody, or jail, they would potentially be put on a type of probation, where in essence, as long as they do these treatment programs, they don't necessarily go right to jail. I've had employees who were in the TAD program. They were drug offenders where they were allowed to be out as long as they met qualifications of going to treatment, seeking counseling, and didn't recidivate. So those are the kind of good programs that I think work in our area. But then again, I think a 10% increase is pretty sizable. And it was so disappointing, though, that every single Democrat voted against the budget that include funding like that. So, it just seems like we want to try to prioritize it. For some, it's just never enough. But I think that was a good, healthy start.
Thank you. One of the other issues I wanted to bring up is the mental health workforce. There's currently a shortage of mental health professionals in Wisconsin and Racine County. Do you have any specific proposals to develop and expand the mental health workforce? And I think I'll stick with the minute and a half that seemed to work pretty well for people. I want to start with Bob, if that's okay.
Always all right. So Stephanie, there are a number of things that we have tried to take a look at to see how we can increase the professionals that we have. I believe in the last session, we took a look at policy decisions to look at hours that specific psychiatrists have, and look to lessen some of the regulations they have in becoming able to practice here. In the last bill that we passed before the health, or right about in the health emergency, we looked at a number of different provisions in there that would allow reciprocity between other states. And then we've looked to try to expand services with some of the things that we've funded, like telehealth, that will bring people services in a different format. I've also talked with some of the counselors in our schools. There are ways that they can increase the number of hours that they put in to be able to deliver a higher level of service than what they do currently in our school settings. And so the other places, with the work that we do with the Colleges and Universities Committee, we are constantly working with people in our education arena to see how we can bring more people into the pipeline and bring them into our communities. Thank you.
Thank you, Bob. And August, if you could follow up.
Yeah, so I think that number one, we got to look at the salary of mental health professionals in the state of Wisconsin. It hovers around $40,000, and that's after getting a master's degree. So you're already looking at a greater financial burden on that. And I think that we need to provide one, tuition assistance as an incentive to get more people in the workforce. This would be graduating from a UW system school and staying in the state of Wisconsin for X amount of years, let's say 5, and you'd be able to provide 15% of their, or pay back 15% of their student loans. And so we need to provide economic incentives for people to stay in the state of Wisconsin. And we also have to look at salary for mental health professionals. It's so low. People are looking at other career paths because they can't afford to feed their family. They can't afford to take care of themselves. And so we really need to look at our priorities. And if we want to make this a top priority, we got to get the best talent possible. And by doing by getting the best talent possible, we got to raise the salary for those individuals.
Thank you, August. Will, if you want to go next.
Yes, absolutely. You're actually talking to someone who benefited from the ability to work in mental health without having a major licensure. I was a veteran peer support specialist, which is a VA funded position at most VA facilities and also some that receive service. And so it's going to be a matter of finding out who are these mental health professionals and how do we put them to work. One of the great ideas that was brought up here during the forum was the implementation of a hotline. For example, we've all heard of that we have the VA suicide line. We need something like that to be implemented for everyone, not just such a niche sort of community as that. And so what you'll have is we'll have to take a look at what we need licenses for, as opposed to just creating the infrastructure in place. If we have a statewide call line, that's going to take people working at the phones and making referrals to community organizations. That doesn't take a college degree to do. That's the same sort of switchboard work that some of our friends and family members had done in many times past. And so it's not to discredit the need for high level of licensure, but we must get people working as quickly as possible to support this without convoluting it with all these different levels of education, when what we really need to do to help people get to work and to have a living wage is to provide the opportunity to go to work in these areas. And so that is something that I am very much a proponent for, is to have and to also to build a coalition. Once again, as a veteran, I can tell you that the money that is put into us, we can pay for every 3 veterans, we can pay for at least 1 more person. So just having that infrastructure in place is going to change that narrative, but it cannot be delayed.
Thank you, Will. Hey, Greta, would you like to follow up?
Sure, thank you. So working as a mental health professional is, of course, an extremely rewarding career. And I believe that we need to start by showing that to young people. And one of the ways, of course, that we have been doing that in Racine, and I hope we continue to, is through Racine's academies, which we are so proud of in our community. These are opportunities for young people to get a sense of what a profession could look like and start down that path, even getting credits in that future career. We also, as August mentioned, really need to financially support those who want to start or go back to school for behavioral health, including looking at loan forgiveness programs and tax incentives for those who are committed to serving underserved communities and areas. This is something we've looked at over the last couple of years in Wisconsin, and I really think mental health needs some thought in this area as well. I'll finally, of course, just circle back again on telehealth, right? We need to make sure that everyone has access to internet to help alleviate some of these shortages in specific communities as we grow the workforce. Our mental health and generally healthcare services, I think, are never going to look the same after COVID. I think many of us are going to be using telehealth for services going forward. And so if we can expand that and allow those who maybe previously tried to find a provider but couldn't in their community to have access through telehealth, I think that would be incredibly meaningful as well.
Thank you. And Robin, if you could go next.
So 2 things. First of all, to August, some of the things that you brought up, we've already done. So that's really good news. We actually, in November, Governor Evers signed a bill that I think passed unanimously. I don't remember if it was, but I'm pretty sure it was, that dramatically increased telehealth in Wisconsin. It was considered groundbreaking and one of the models for the rest of the country that the National Conference of State Legislatures has looked at to say, do it more like Wisconsin. It was done before the COVID virus even hit. So we were ahead of the curve, and that's something we can all be proud of. The other thing that we were ahead of the curve is when we did the Speaker's Task Force on mental health, one of the programs that came out of that was a grant program similar to what August talked about, where we already have a program in Wisconsin where we help by forgivable loans and grants supported through the Wisconsin Academy of Family Physicians, where there is an allocation for folks to go into psychiatry as long as they go into underserved areas. Because the problem, while it's all the way through the mental health care system and we need more folks doing everything from intake to treatment, the most acute need is for more psychiatrists, people who actually have the technical training to provide the long-term care that a lot of these folks need. So Wisconsin, again, was ahead of the curve on that. We could certainly do more. It's not the end, but it's something we should all take credit for. So I think the workforce is one of the areas we really need to focus on. It's something that I know our healthcare systems are looking at, as are many of the organizations helping the folks who are in most need. So two good things we've already done, but we certainly can do more in those areas.
Thank you, Robin. And Joel, if you want to follow up.
Great. Thank you, Stephanie. Great ideas from everybody, Greta, Robin, August, and glad to hear what has been done. Certainly, just to reiterate, I had a conversation yesterday with an emergency physician here in Wisconsin. He said one of the things that is most needed is more staff. And we've talked about the efficiency with telehealth, improving the education and incentives for education. I think mentoring, if it hasn't been mentioned, probably has at least inferred to mentoring, even at high school level, taking them into areas of where they can see how behavioral health works. But again, that's number one is what he said. Number two is insurance from his standpoint in dealing with psychiatric patients. But number one is start bringing on more staff, and all these are great ideas to do that. So that's sounds like we're moving forward, but we got a lot of work to do.
Thank you, Joel. Appreciate it. The next question is Medicaid. Do you support Wisconsin accepting increased federal Medicaid funding as authorized in the Affordable Care Act? If so, how do you propose funding this expansion when federal contributions are scheduled to decline? If not, what alternatives do you propose to ensure that people living with mental illness with limited incomes have access to quality, affordable mental health treatment and services? And August, if we could start with you.
Yeah, I do support the Medicaid expansion for the state of Wisconsin. We've already paid it with our taxpayer dollars. We paid for the expansion. And so it's over $300 million that's just sitting on the table that our state legislature has failed to already accept. 39 states have already accepted this expansion, and I don't understand why we're opposed to it in our state, why no one's actually acted on it. And so, and also we are already at the lowest lowest payout that we can get from this since we failed to act on it. And so the payments wouldn't decline. So I do support Medicaid expansion in the state of Wisconsin.
Thank you. And William, if you could go next.
Yeah, see, the thing with that is that's for medical treatment deals there, and that's where we have our greatest shortfall. Right now, we have medical professionals in ERs actually happen to date an ER nurse. And so what happens on a typical day is they will get an influx of folks that are in poor mental wellness. Mental wellness in healthcare, they're not the same deal, even though that some of those folks will have prescriptions for some really hardcore psychoactive drugs there. Overall, when it comes medical monies should go toward improving our medical facilities. And what I'm talking about is effective triage. So it's not just a matter of accepting that money and then putting it towards something that it should never have been used for. And so what we'll need to make sure that we do is that, moving forward, I know we operated with a kind of a state surplus in some recent years, and that surplus didn't go toward very much of anything that was serviceable for many folks that lived in Wisconsin. So moving forward, if we are to accept any medical monies, those should go to updating our medical facilities to deal with our present pandemic, to help make sure that we are alleviating all sorts of medical burdens here. We're going to have folks that are going to have increased costs associated with COVID, not to mention our mental health shortfall. So, and it's not as far as towing a party line as a business consultant. I'd advise any mom and pop shop, you know, if you're going to get these monies to improve, if the monies come in to improve your parking lot, you shouldn't use those monies to buy new equipment. And so what we want to make sure that we do is that we spend the money where it needs to go, and that we don't just arbitrarily take more money and still have to have these conversations on where to spend it.
Thank you, Will. And Greta, if you could follow up.
Sure. So Medicaid, the Medicaid expansion is a critical decision for us in the coming year. I believe that not accepting the Medicaid expansion is one of the worst decisions Republicans have made over the last 10 years. And frankly, I feel that it is unconscionable that we have people right now in Racine, in a pandemic, in life-threatening situations, who are deciding whether or not to go to the hospital based on whether they can afford it. And if we accepted the Medicaid expansion, thousands more people in Wisconsin would have care. And as has been proven in other states, premiums on the private market would decrease as well. And I would challenge anyone to find someone in our community who doesn't want their insurance premium to go down. Because we have waited so long to accept the Medicaid expansion, we have reached the lowest reimbursement level available from the federal government, which means that these dollars will be coming for many years. And again, as August mentioned, we've put the money in, it's there, and accepting the Medicaid expansion is the best way to cover more people cost effectively and decrease our healthcare disparities by income, race, and gender in the state. Additionally, under the governor's plan to accept the Medicaid expansion, we would inject millions of dollars into mental health care in the state. So really, this is a common sense, extremely popular policy, and I am very hopeful that we will implement it next year.
Thank you, Greta. And Robin, if you want to follow up.
Boy, 90 seconds for one of the most complicated issues that we have in the state. So
Good luck.
I do not support taking the Medicaid dollars, and let me explain quickly why. Wisconsin already has the lowest uninsured coverage rate of any state that has not taken the expansion, because we did it our own way, which actually made economic sense. What happens is people are paying higher rates when they go to the doctor to the healthcare system because they're getting insurance from the private sector. Medicaid pays a rate that is significantly below the cost. So every person on Medicaid has to be subsidized by somebody who has private insurance. We know that to be true. Just accepting the Medicaid expansion by having this extra people going on government insurance as opposed to private insurance would cost just hospitals $200 million a year. So the extra dollars that we think we're bringing in from the federal government, we have to put in state dollars first. We've already done that by buying down premiums, would go toward just sticking toward the deficit that'll be caused by the reduced reimbursement rate. So it's a Ponzi scheme. It makes no sense to do it. We've got a great way in Wisconsin where if you are at 100% or below, you already get coverage, which is much more expansive than most states have had. If you're above the federal poverty level, you get subsidies from the federal government on the Obamacare exchange. If you're above that rate, hopefully you have private insurance and you have the ability to take that with you whenever you go to a job. If you're on Medicaid, we see people are trapped on this system where they cannot earn more money because there are such severe income limits on the system. So Wisconsin has a creative way to do it. It's economically smart, it's compassionate, and is why Wisconsin has the lowest rate of uninsured people among the states that have not done.
Sorry, I moved my buttons wrong for a second there. Thank you. You kept it right at the time. Appreciate that. Joel, if you want to go next.
Yeah, quick question, Robin. Was that federal deficit you were speaking of? You said deficit. Were you speaking of the federal deficit?
You mean the deficit in the amount of spending that would happen?
Oh, I thought you referenced deficit. I wasn't sure if you meant federal or state.
Yeah. There's actually, just so you know, there's a huge surplus actually in the Medicaid budget right now that Governor Evers isn't even spending. So that's an interesting thing.
Okay. All right. Anyways, I'll go ahead here. All right. So this is the biggest issue, and as I said, 90 seconds. Mr. Voss, certainly we need a lot more time than that. We'll talk about it for years. United States is the only one that has this sort of type of insurance going on. And we're running at, Australia and Canada run per capita half what we do for universal health care. We need a major revamp. It is the biggest concern of anybody, and we've all here knocked on doors. What is the biggest frustration, fear from them is the cost of their health care. Our system is horrendously broken, and we need to revert to, at some point, to the a single payer or a universal type healthcare. And so with that in mind, the Medicaid expansion is just a Band-Aid that we have to operate under the temporary situation that we're in right now. But we're going to have to move to a much different type of situation, and we can do it and provide better outcomes than we are currently in the United States. Thanks.
Thank you. And Bob, if you could go next.
Thank you, Stephanie. I do not support taking the Medicaid money. I think Robin described a number of the reasons rather well, but I would also point out that one of the things that isn't talked about a lot is that if the federal government fails to keep up its end of the bargain, the state once again has to step in and pick up any deficit that goes along with this. I don't believe in any type of plan that will switch people off private insurance and send them into other programs. I think that's a recipe for disaster. The other thing that doesn't come up a lot is everyone always says, well, there are 39 states that did this. Well, maybe you should take a look at what some of their experience has been over the long term. You've got Kentucky, where they faced over close to a $300 million shortfall that they have to pick up, which would be 6.9% of their budget. So especially now when it seems that the federal government is printing money at an exorbitant rate, I don't believe it's the right time to inject this money into our system and then be responsible for any shortfall that comes forward. I believe in budgeting prudently and continuing to do programs that will make us self-sufficient in this area rather than dependent on another government entity. Thank you.
Thank you. And I believe we started that one with you, August, right? Yes. Okay. So I think we're back to Will for starting. Access to treatment and services. There is increasing evidence that early intervention for young people with mental health challenges, particularly depression and first onset psychosis, can drastically improve immediate and long-term outcomes. What specific measures will you support in the next legislative session to ensure that evidence-based mental health services are accessible and available when needed?
Absolutely, thank you. And that's why you heard me mention that charter. We're going to keep bringing it up because what we'll need is a huge commitment. What we know is that we have population centers here in Wisconsin, and in those population centers, just as many concerns with many legislatures over the state that the population centers are going to soak up that money. I don't want that to happen because just because more people live in Racine than live in Raymond, mental health, mental wellness is poor, kind of everywhere. And so what we'll want to make sure that we do, especially for youth, is to have properly funded. There's a lot of talk about, and a lot of heart and minds that are going into the defunding of law enforcement agencies, which on the back end of that, if we are going to work towards some sort of defunding, even though I cringe at the thought, we're going to need to make sure that those monies are allocated back into the community for programs like youth mental wellness. I heard Greta mention that there's a young gentleman or a young person in middle school who is heading up those efforts, but a middle schooler is not going to be able to be employed and to then be a peer support for their peers. So what we want to make sure that we do is to properly staff and to have organizations, the infrastructure properly funded and put in place so that we can begin to address these issues, as opposed to just spending money into a brick and mortar school that may or may not be there. And we're seeing, we know that we're losing 9 schools. Oh, sorry.
No, good. You were watching the cues that time. And Greta, if you want to go next.
Sure. So this is a really critical issue in our county, which I have heard about certainly from many people who are concerned about friends, family, neighbors. Also, I've heard about this from law enforcement. I did a ride along with the sheriff's department a couple months ago, and they talked about how they are often driving hours or waiting a really long time to get those who are experiencing a mental health crisis to see a provider. So this issue is really tied into many that we've already discussed. It is tied into these conversations about adequately responding to individuals who are experiencing a crisis. It also is critical that we make these long-term investments, that we accept the Medicaid expansion, which, as I said, would also put millions of dollars into mental health resources in our state. We also need to be thinking about our schools. There was an opportunity in the last budget to accept the Medicaid expansion to make a truly historic investment in our schools. We did not accept the Medicaid expansion. We made some additional investments in our schools, but it is not anywhere near enough. And anyone who's talking to young people right now knows that. So we're going to spend a little more time, I think, in another question talking about those investments in our schools, but certainly something that I support is making those additional investments in counselors that are local, that can serve students where they are and when they need them.
Thank you, Greta. And Robin, if you want to go next.
In the last budget, we really focused on some of the programs that help young people. We did school-based mental health clinics. We did grants for that. I think there are several schools in Racine that actually participate in that program in Racine Unified. I know that I have toured and worked with Children's Hospital, as they have been on the forefront of trying to provide children's pediatric mental health services. So I think those are 2 areas that we need to do as much as we can, because you're right. The sooner we get to a child who has mental health issues and the more they get treatment, the better off society is, and frankly, so is that family and their kids. But there are some things that we have to realize as well, that I know Greta just mentioned how if we had taken the Medicaid expansion, that somehow we could have added that to school funding. Well, that's the problem, that it's not just about spending more dollars, it's about spending the dollars that we have smartly and making sure that we make investments with some kind of data that shows that they're going to work, like we're doing. We have made targeted investments, and as those programs show that they work, we expand them because we have data that shows they're actually providing a sincere and serious return on our investment. I think that's a smarter way for conservatives and the way that we've chosen to govern. It's not just raise taxes, increase spending, and hope for the best, which seems like it's what many of my Democratic colleagues have as an unwritten rule of how they propose ideas in Madison. More spending, more government, hope it works. So I think our targeted approach is significantly more successful, and hopefully it'll continue to be in the next budget.
Thank you, Robin. And Joel, if you want to go next. And if you want to unmute yourself.
Thank you. Sorry about that. In the NAMI website, it does discuss the recommendation to go to the 138% of the federal poverty level. I certainly am in full agreement with that. We're on an economics discussion here, obviously. I'm going to beg to differ with Mr. Voss relative to evidence-based outcomes and it's going to take some increased taxation at a certain point. We are looking at 1% owning 45% of the entire net worth of the entire United States, and Wisconsin matches that. I think there's some people who can give up a few dollars here to help us out on mental health and public schooling and a few other things too.
You were muted there, Stephanie, but I could kind of make out the words.
Oh,
So,
sorry. Yes, you are next.
Quite
Thank
all right.
you.
Quite all right. So I'm going to go back to my experience in the board of education here. Robin made a good point, and I believe it as well. Targeted funding, to me, is the best way to work through this to ensure that locally it's spent on something and we see the results from it. Fortunately, at the state level, in too many cases, we appropriate large sums, but don't always kind of take a look at what it does at the local level. When I was board president, there's a community school at Knapp Elementary. One of the things that I think should be emphasized is the program that they have there are the result of many partnerships with a number of other providers. And so just throwing money at a particular issue isn't necessarily going to get what you want. But if you have the right people in the right place, doing the right things with kids, even in the toughest school. And the other benefit to that school is that they involve the entire family. So on Thursday nights, you will see 300 people at a family dinner. And I think that helps in getting, identifying issues early on, getting the family involved, and getting children the help they need. That program is extending to Julian Thomas School this year. And once again, a lot of it's dependent on the local resources that are spent. So I'm more of an advocate of let's do programs that work rather than just send money and hope they.
Thank you. August, if you could go next.
Yeah, so in trying to increase the access to services, we have to look at two things. One being taking the Medicaid expansion money. That's, like I said, it's free money that we're missing out on that could be used for so much to expand mental health resources and physical health. I know Will talked about that there's a divide, which there shouldn't be. It should all just be health. And so mental health, I think, is the same thing. And we need to use that money from the Medicaid expansion, portions of it, for mental health resources. And two, I would like to see, we talked about the economic incentives and higher salary. I think that we need to look at those options as well to get more professionals in the field.
Thank you. And we don't have a ton of time left, and with the Zoom format, it does make it a little difficult to get some questions, but we did get a couple. And there is one I want to get to for sure, which is, what about legalizing marijuana for treatment of PTSD and depression? And Greta, if we could get started with you on that and just do a minute.
Sure. Yeah, so I have supported legalization of medical marijuana in Wisconsin. I also have supported efforts to decriminalize marijuana in Wisconsin. We know that this is tied to many other issues, including over-incarceration. And so those are two concrete things that I've supported. The evidence on medical marijuana is clear, and I think we should be taking action on that as soon as possible.
And Robin?
I am in favor of medical marijuana as well. I have been one of the first advocates on the Republican side, along with my former colleague, Adam Jarko. I think that was 4 or 5 years ago. My colleague in the state Senate is not in favor of it. So while we have started the discussion, there's a Republican bill that has moved its way through the process. I think it's something we definitely want. Anybody who has a loved one that deals with chronic pain, I have people who I have loved in the past where chronic conditions, there's no treatment, there's no drugs that help deal with it other than painkillers. And over a lifetime, use of prescription drugs certainly is not good for your body, it's not good for your soul, and it's not good for society. So if we have the ability to use something like medical marijuana as a way to help people treat chronic pain, where it's done in a sincere way, it's not abused, it's not just a gateway to recreational marijuana, which I am opposed to, I think that is something that we should definitely do in Wisconsin. That's why I was so disappointed that Governor Evers, in his typical fashion, rather than saying, look, let's try to focus on what we can do, which was medical marijuana, he wanted legalization of everything. And that kind of blew up the discussion where it really stymied our efforts to get progress on medical marijuana. So my hope is we can hit the reset button, come back next session, and hopefully move that issue forward.
Thank you. And Joel, if you could go next.
Yeah, thank you, Stephanie. Certainly, I am in full favor of medical cannabis to be a program that should be implemented immediately. I think Mr. Voss's comments, Greta's comments, they're all in line on that. And I hope that can take place, that the Senate starts to move off of this, because every non-binding referendum that we've had in the state has been overwhelming that the people of Wisconsin want that. So I'm not quite sure why the Senate keeps balking on it. As far as recreational, hi, Stephanie.
Sorry about that.
That's all right. Never
realizing,
mind. And I'm focusing on you. Sorry about that. But as far as recreational, I think one of the things we could do a I know it's against the Constitution to do a statewide referendum, but why couldn't we do non-binding referendum simultaneously every county? As far as I know, every county has said, we want recreational. It affects the incarceration rate. It will help bring dollars into our state. I know it's a drug, but I think via education and looking at Colorado, California, Oregon, Washington, on and on and on, we can learn the lessons to make sure that we do it safely and that it's what our the citizens of Wisconsin want. Thanks.
Thank you. Bob, if you could go next.
Thanks, Stephanie. I'm not in favor of legalizing recreational marijuana. I believe that cannabis for medical uses should be considered. There are ways that we may be able to structure that so that it would be acceptable in this state and would help the people that need it the most. But I would not be in favor of recreational. And I believe that you should, Joel brings up a good point, but I think you should take a look at all the issues that these states that have implemented it and take a close look at how some of it has affected, especially in Colorado, some of their healthcare costs and the money they propose to go into schools to find out actually where it's going now. So, thanks.
I think you were muted there, Stephanie, but
You guys know.
yeah. So I am in favor of legalizing medical marijuana. There are thousands of people out there that could be using this as a painkiller rather than going to opiates, rather than going down that avenue. And so I do support medical cannabis legalization. Recreational, I am also a strong proponent for. Bob and Robin love to talk about taxes and spending and stuff like that. While we're losing all that money to Illinois, Michigan, our neighbors that have it legalized, and they can just go right across the border and get that, get cannabis or get marijuana, and those states are capitalizing on that tax revenue, and we're losing that all while still spending the money on locking people up for something that's legal just south of us and just north of us. And so strictly from an economic standpoint, I think that it's a great idea to legalize marijuana, recreational and medically. And then also you've seen the issues, or you've seen the success stories from Colorado, California, Oregon. And I think that we could really use that extra revenue in the state of Wisconsin.
Thank you. And Will, if you want to go next.
Absolutely. The conversation around mental wellness, when you work in the field, what you'll know is that for many years before people can get help with psychoactive prescribed drugs, that they were self-medicating. In our state, we spend a great deal of our time overcast. Right now, the only drug that we have that people can self-medicate with and harm themselves is alcohol. It is still a drug, and Dad still sometimes has his drink to unwind from a stressful day at work. That is someone self-medicating for a depression or any other there. And so when it comes down to that, a concern that Speaker Voss brought up that maybe he was lampooned about, but maybe if we were going to have a responsible conversation, we could have heard what the concern was. No one wants to see a 6-year-old child who may be suffering from trauma sucking down on a joint just to get by. Okay, we'll need to have a conversation with what does medically prescribed cannabis or marijuana look like to many different people. And as far as the recreational marijuana concerned, I think that is what really harmed our ability to get a responsible medical marijuana legislation passed, because you can't lump the two together. A representative that's out in the county is going to sound far different from a representative in the city. So while I am certainly in favor of recreational marijuana, I can hear the conversation from my colleagues and people that I care about who think that perhaps with a uncontrolled, unmitigated recreational use, no one wants to walk to a park if they don't partake in marijuana and smell that smell, just the same way that no one who doesn't drink or smoke cigarettes wants to smell that smell around them. And so while I am certainly the spirit with some of the other folks from the other side of the aisle, I am right there with you. But we have to understand what some of these concerns are from areas that aren't as urban as it was as a Racine or Milwaukee. And so once again, we'll have to.
Oh, they caught you. They got you on the mute. So we're kind of rounding out on time. When I look off the screen, I'm looking to some of my fellow representatives here from NAMI, and I'm just gonna see if Pat, did you want to make any closing remarks at all?
Thank you all very much. We greatly appreciate the involvement of all the candidates for office and your support for mental health issues. Very productive conversation, and we hope to continue it. Thank you. Back to Stephanie.
Thank you. So now we're back at our proper 6 feet apart. So take it down. And what I wanted to just give you the chance to do is to have your closing remarks. If you could just limit it to 1 minute. I mean, obviously in November, the public has a big decision. I mean, all of you are great candidates and we really appreciate the time that you took. But if you want to try to say in 1 minute why you are the better candidate of the two of you, we'll give you that chance. And for this, I think, were we on Robin? I'm trying to think of starting first. I believe so. Robin, if you want to get us started with 1 minute on why you're the best candidate.
Well, thank you, Stephanie, for moderating. Thanks to Pat and NAMI for doing the event. I appreciate the chance to have a discussion that is civil and find some areas of agreement. So think about what's best for you as a voter and for Racine County. And I hope that as the Speaker of the Assembly, where we've been able to have, again, 90%, 91% of the bills that we passed have been bipartisan. We were able to take and stand with our conservative philosophy of governing, which is why we have a surplus that's going into COVID. It's why we have a huge rainy day fund, but we were still able to make investments in healthcare and education and a tax cut for every single person watching. Wisconsin can do all that, but only if you have good leaders who are willing to work with everyone, listen, and fight for the principles that are important to those of us who live here in Racine County. I love where I live. I love the ability to fight for the things that I believe in on behalf of the people who work, live, and want to hopefully retire in Racine County. We live in a great place. I hope to earn your vote again between now and November 3rd, because Wisconsin is going to have critically important choices to make over the course of the next 2 years. Do we keep moving forward with a balanced budget and good economy going forward, or do we not? COVID is important.
Oh, thank you, Robin. Joel, if you could go next. Oh, if you want to unmute yourself. I know I'm guilty of it as well.
Sorry, my mouse wasn't responding there. I also want to thank you, Stephanie and NAMI, for this very civil conversation. It's a pleasure to talk with Robin and Robert and everybody here, Greta, August, and Will, of course. And I greatly appreciate the civil conversations because that's how we're going to solve the problems of this state. I think the choices are very clear. I'm going to say that we are in a situation where I don't believe that we have a representative government. We have a situation where we've been ruled by Harvard recently as probably one of the most authoritarian governments in the United States, and it's due to gerrymandering and voter ID laws, and we're not getting what we need from our representatives. And so, as talented and as bright as Mr. Voss is, I think I could do a vastly better job and be a lot more responsive to the citizens of 63rd District. Thank you.
Thank you, Joel. Bob, if you want to go next.
Thanks, Stephanie. Thanks for inviting me. I think it's a very worthwhile conversation. And so I would agree. There's definitely a choice. I believe that we will face unprecedented challenges in state government level as we get into the next biennium. Many of those will revolve around our budget, making prudent investments, and sending us back on the path to prosperity. So I believe that my personal experiences, my finance and accounting background, the work we've started in the Ways and Means Committee, and all things set me up greatly to be of great service to the people of the 62nd District. And for all the dads out there, I will make one comment, and that is those of us that have teenage children, we understand quite a bit about the younger generation now because they keep us on our toes every moment of every day. And so don't discount the fact that where we sit now, I think we have a great understanding of the issues we're going to face. And I just look to earn your vote between now and November 3rd. Thank you.
Thank you. August, if you want to go next.
Yeah. One, I want to say thank you to NAMI for tonight. I want to say thank you to you, Stephanie, for moderating as well. We've seen the failure of our state legislature to actually do anything. I mean, we're going on over 6 months of failure of inactivity by our state legislature, and that's led by Robin. I'm sorry, but it's been inactive. There's many unemployed. Over 1,000 people have died in the state of Wisconsin. Over 100,000 cases of COVID-19. We're the hotspot of the nation, and there hasn't been anything done by the state legislature. They're using our taxpayer dollars to take Governor Evers' orders to courts to overturn them, even though they're trying to prevent the spread of COVID-19, trying to keep everyone healthy. And so we've seen what the Republicans have done with the pandemic and how they've botched public health. Why would you trust them with your mental health as well and mental health resources? So I think the choice is clear. There's a candidate that's going to stand up for the people in his district, that's going to go to Madison to make sure that the state legislature actually works for the people of Wisconsin, and that's me. And thank you again so much for tonight.
Thank you. And William, if you want to go next.
Absolutely. When we began this, and thank you for the opportunity to engage with folks there. When we began this, we wanted to make sure that we had the best representation and the best voice going forward to represent our city. For far too long, it has been one side only that has spoken for so many and not been able to speak for them at the same time. Our campaign is a people-focused campaign, from safety to wages to housing to mental wellness, mental health treatment. We chose those issues not to talk down to people or to talk to people, but because those have been the shortfalls that have missed so many in our community for so many years. And those are four key focuses that are not respective to your point of origin, to your economic status, or to your race or color of your skin. And so that is why we chose our focus 4. And we truly believe that with our experience as a father, a former business owner, a veteran, and a community servant, that we are the best moving forward to represent the city of Racine and to turn our narrative for the better.
Thank you. And Greta, if you want to round us out.
Yeah, so just again want to thank Stephanie for moderating and Tanami for this forum and of course all of your ongoing work. So as has been said, it is a big choice that folks are making when they are casting their ballots this fall. Republicans can say that they support these issues, but you all know, you can look around and see that the status quo is not acceptable. And Republicans in leadership in the state assembly have maintained the status quo. As August pointed out, we have not met in session since April. This is while I talk to constituents every single day who are in crisis, who are in mental health crisis, who don't know where they are going to sleep at night, who don't know how they are going to feed their kids. We need leaders in Madison who want to go to work, who are ready to implement the bold, progressive solutions that Racine needs to recover from this crisis and to recover more equitably. So thank you all to my constituents who are out there for electing me twice to fight alongside you for better for our community. And I certainly hope to earn your support to continue this work next year.
Well, thank you very much. I think I got everyone there right on the closings. Trying to keep track of my notes to get around the table, but we went just a couple minutes over 7:30, and I know everyone wants to get to the Packer game and catch what's going on. I hope we didn't miss anything too much in those first 7 minutes, but we'll catch up, and probably most of us can start from the beginning of the game anyway with our live devices. But I really want to thank you guys. This is obviously a huge issue, vital for our entire community and for our state. So I really appreciate your time. Pat or Nicole, was there anything else, or does that round it out?
I think
So,
that's
yeah.
about it. I just want to remind everybody that's still watching, we have a bunch of events going on through the week. This is Mental Illness Awareness Week. We will be doing a live chat with Congressman Brian Stile on Wednesday at 1 o'clock. So I hope you guys can join us for that. And then we do have a candlelight vigil on Friday at 6:30, where we'll be meeting at Monument Square and then walking down to the courthouse and saying a few words. So keep an eye out for the events, check out our Facebook page. And again, thank you to you all for joining us and doing this with us.
All right, thank you. And
Bye,
good luck to all of you.
Thank you all. Be safe, and God bless, God keep you.